Welcome. My name is Jill. I am the clinical educator for Pediatric Home Service. I am going to be demonstrating sub-Q IG administration via the Freedom60 pump. The first thing you want to do is make sure that you wash your hands. Use your hand sanitizer. You're going to be able to wipe down your clean zone and put a drape down and put all of the supplies on that clean zone. Your sub-Q IG or your Hizentra. Make sure you check the labels on the package to make sure that you check for the 5 rights of medication administration. Your syringe, your tubing, this is your needle sets. You have 2 different types of tubing that we'll discuss later as we set it up. Your pump, alcohol prep pads, your lidocaine ointment that will already be on the patient, 2x2s or gauze to wipe away the lidocaine ointment. Your transfer devices to draw up the medication into the syringe, bandages and gloves, and a sharps container. So the first thing I'm going to do is I'm going to go ahead and get all of my sub-Q IG vials ready. I'm going to go ahead and pop the tops off of every one of them. And the dose varies between patient. So this patient requires 6 vials. I'm going to alcohol the top off of every one. And you want to make sure that you scrub them for 15 to 30 seconds every top vial. Use a new alcohol prep pad for each one, and then let them dry while you're doing the others. Sub-Q IG is very thick, so when you draw it up into the syringe, it tends to draw slower because of the thickness of the IG. Remember that on your vials, there are labels that can be peeled off with the lot number and the expiration date. Make sure to peel those labels off and put them in the journal, the IG journal, so that you keep the lot number and the expiration date in case there was to be any concerns with any of the lot numbers. If you contaminate anything during your setup, you start over from the point of contamination. While you're getting set up, your patient can have their lidocaine cream on. Depending upon the cream and the ointment, it's anywhere from 15 to 30 minutes to numb the areas where you're going to be inserting your needles. So be sure to put that on ahead of time. And again, scrubbing for 15 to 30 seconds, each and every vial with a clean alcohol prep pad every time. Now my vials are ready. I'm going to go ahead and use my transfer devices, my dispensing pin, and I'm going to be inserting that into every vial. Again, keeping the pin itself that's inserting into that vial sterile. We're going to leave the cap top for right now and leave it on. I'm not touching the top of the vial, and I'm making sure that this dispensing pin is staying sterile. Not touching that at all. Again, if you contaminate anything, start over from the point of contamination. And we will use a clean, sterile transfer pin for every single vial that we use. I'm going to go ahead and stick a clean, sterile one on every one. You don't use one pin in multiple vials. It's a sterile pin in every vial. While you're getting ready and your patient has their lidocaine ointment on, they may be starting to become stressed. So it's very important that we use distraction techniques for these pediatric patients. And that might be a movie, that might be their iPad with a game, that might be songs or music, whatever de-stresses them. We want to make sure that we do that. So just think about that, getting them settled into an area. It's nice to do this away from them when you're setting all of the supplies up, because that just kind of increases their level of stress. So now I have my dispensing pins in, and I'm going to go ahead and I'm going to just open up each of the vials so that I can pull up that medication with my syringe. The tops are a Luer lock, so my syringe is a Luer lock syringe, so it will screw right onto the top of every vial. So I'm going to take my syringe out. I'm going to leave my tip sterile. I'm going to leave the inside of the package sterile also. Pull that out. Okay. And then I'm going to go ahead and start drawing up my vials. So I'm going to screw it on. It's a Luer lock, like I said, and I'm going to go ahead and just start drawing up the Hizentra. You do want to pull that pin close down to the edge without pulling it out of the vial to get every drop of the IG in your syringe. There can be a little bit of air that comes, so as you can see in this one, I'm just going to tap the air and just push it up and in, and then I'm just going to start pulling more of the sub-Q IG out of the vial. Again, I'm just bringing my pin down to the end of the vial without actually having it removed from the vial to get all of that dose that's in there. I'm going to be doing that with every one, keeping my tip of my syringe sterile and also the tip of each of the dispensing pins sterile where my syringe is going to attach. Everything needs to be kept sterile. We're almost done drying up. A little bit of air bubbles can get in there, so I'm just going to push those to the top again. And we have 2 more vials left here, and then we'll have our Hizentra dose drawn up. And again, just drawing that up. And 1 more vial. And then I'm going to be showing you the tubing that we're going to be using. I'm going to show you 2 different types of tubing that may be attached to the syringe itself as we get ready to show you that. And I'll explain the differences as we go here. I'm just going to get all that little bit of air and put it back in my vial here. Okay, so I have just a little bit of air. I'm just going to tap that to the top. Now I've kept this sterile, so I'm just going to put my syringe in here for a minute. So we have 2 different types of tubing that you may encounter. We have the precision flow rate tubing, which this tubing hooks to the syringe and then to your needle set. This tubing is what determines the flow and how fast the sub-Q IG is going to go into the patient. This is another type of flow tubing device. This is called the Versarate. This too would hook from the syringe to the Versarate to the needle set, just like the flow rate tubing would hook from the syringe to the flow rate tubing to the needle set. I'm going to demonstrate both, setting up both, and then we'll demonstrate actual inserting the needles with the Versarate. So you may encounter either one. You will not use both. So the first one, the flow rate tubing, you would just take out of your package, open up your package, take it out. It has 2 ends on it. It has the end with the round disc, and it has the Luer lock end on it. So the round disc would go ahead and you'd keep your cap all sterile. go ahead, and the round disc always hooks to the syringe. That's an easy way to remember it. So it would hook to the syringe like this. Then I can just let it sit right here. I'm going to keep my cap on so it stays sterile. I'm going to go ahead and take out my needle set. And it depends upon the volume of the IG that you administer as to how many needles you're going to have in your needle set. So in my needle set, this particular patient is going to need 4 needles. She's got her tegaderm that will go on over the needle sets. The tubing just kind of comes wound up like that. I just unwind it. So I'll have my 4 different needle sets. But this end is going to hook on to the flow rate tubing. So you would go from your syringe, the flow rate tubing, hooked onto the needle set. Then we would prime the flow rate tubing all the way through to the ends of the needle sets without letting it come out the actual end of the needle. And I'm going to show you that with the Verserate, but I just want to show you what this one would look like. So again, this tubing right here, this is your flow rate tubing, this little segment right here, that's between the syringe and the needle set, that is what determines the rate at how fast this infuses into the patient. And we have different flow rate tubings. So that's the flow rate tubing. Now I'm going to go ahead and show you the Verserate. So I'm going to leave that connected for a minute to keep those sterile. The Verserate is a little dial flow tubing. And the nice thing about the Verserate is that, again, the disc end is going to hook right to the syringe. The other end is going to hook up to your needle set. But the nice thing about this is that it has dials on it. So it goes from off all the way up to 6 for the highest flow rate. So when you're administering, if your patient was to get, for instance, uncomfortable and start complaining of pain, you can turn the dial down and slow down your flow rate. If the infusion's going in somewhat slow and they're tolerating it just fine and they would like to speed up the infusion and the doctor says that's fine to do, you can turn up your dial flow rate and infuse it a little faster depending upon how they tolerate their infusion. So that's a nice thing about the Verserate. It's very flexible. And here with the flow tubing, if they were to get uncomfortable, there is a clamp on it, so you could potentially clamp it, or you could shut your pump off and just stop the infusion for a little bit until that discomfort passed and then restart the infusion. So they're just 2 different types of tubing. You're going to use one or the other. That was your flow rate tubing. So I'm going to go ahead and actually remove the flow rate tubing. I'm going to keep the end of my syringe sterile again. Just going to set in my package. And I want to keep the end of my needle set sterile also, because we're not going to actually use this flow rate tubing. We're going to use a Verserate. So with the Verserate, I have the lure connecting end, male to female here. That's going to go on the needle set. And then again, remember that round disc that was on that flow rate tubing is also going to go to the syringe. So that's the easy way, just disc to syringe. So I'm going to go ahead and put that on, like so. Okay. So now I have my Verserate hooked up. So this is what the Verserate looks like. Again, this is what will determine the flow rate. So now at this point, what I'm going to do is I'm going to go ahead, I'm just going to toss my garbage here, and I'm going to demonstrate how you prime your tubing. So there's 4 needle sets. On this particular needle set, they all prime evenly. But some of your needle sets, they don't prime evenly. So if they didn't prime evenly, you would go ahead and clamp each needle set, and then you would prime one at a time, because you don't want to lose any of your sub-QIG. It's valuable and very important drug. So you would go ahead and clamp every needle set and then leave one open, and you would prime that needle set. Then you would prime the next needle set after you clamp this one, then the next, then the next. But because these all prime evenly, and this particular needle set does, it's a high flow rate needle set, I'm going to leave them all unclamped while I go ahead and prime. It's important to remember We don't want to prime all the way to the end of the needle tip because that causes more site irritation in the skin itself. You want to only prime to the end of the tubing and stop right here before the needle set itself. So stop here. When you prime with the Verserate, you are going to turn your device to number 3. The flow rate with a Verserate is determined by a little calculation that the infusion nurses do on the computer. So they will predetermine, based on the volume of drug that you have, what number your Verserate should be set at. When you prime, however, you want to prime at 3. Okay, so that's what we're going to do. So I've got it at 3. I'm going to have one of my needle sets out because these prime evenly, so I can watch as the drug comes through and then go ahead and ends up coming up to the tip here. And it's pretty tough to push, so I'm going to go ahead and start pushing. And I'm going to watch for my drug. It's going to come here first. And then I'm going to watch it go through my tubing. And I can see it coming through my tubing. You do need very good lighting for this so that you can actually see that come. And it's right here, so I'm watching it come right here. It's going to end up, you guys may not be able to see it, but it's going to stop. Okay, and I'm going to stop. I stopped right here. And then I'm going to clamp each of my needle sets at this point. I'm going to go ahead and clamp so it doesn't escape and get past the tip of that needle and end up causing more site irritation. So my needle, my tubing, my Verserate tubing is primed and my needle set tubing is primed. So now at this point we're going to go to the patient and we're going to go ahead and get them set up. But before I do that, I wanted to show you the pump. So I'm going to show you the Freedom60 pump. This is a Freedom60 pump. It is not battery operated. It is a hand crank pump. You have the little black knob right here. When I turn it and it turns clockwise, you're going to see that knob move up. So you want to make sure that the pump is off when you do that. And I'm going to go ahead and turn it. And I'm going to see that knob come all the way up to the end. Listen for the click. There's that click. What you want to do is you want to check your pump to make sure it's working. So it's in off position. My little black knob is all the way to the top. And now I want to turn on my pump to make sure that that is going to push properly because it pushes the plunger on the syringe and that's what pushes the medicine into the patient. So I want to just go ahead and turn it on and I'm going to let it go all the way to the end. I'm going to turn it on. See the black knob moving and it's coming all the way, it's going to go all the way to the end. So that's what's actually going to be pushing your plunger. Now I know my pump is working. You want to do that each time before you set up and start your infusion. So I'm going to go ahead and just turn it off again, the off and on button here. I'm going to crank it clockwise again. You're going to see that black knob move up to the top. Listen for the click again. There's a click. Now my pump is ready and we're ready to begin with the pump once we get the needle sets placed into the patient after we wipe off the lidocaine cream. So now you're ready to place your needles. First thing you want to do is your skin scrub. You want to make sure that you do your skin prep for at least 15 to 30 seconds. You will have chosen the appropriate site where there's good subcutaneous tissue, usually on the outer thigh, sometimes the inner thighs, the back of the arms, and or the abdomen. But I'm going to do a 15 to 30 second scrub, really, really good, with my alcohol prep. And I'm going to let that skin dry. While it's drying, I'm going to take my first needle. I'm going to take the paper tab, remove that to stretch my tubing. I'm going to go ahead and take the outer elastic band off. I'm going to flip it back, and this is how you hold it, like this. And I'm going to go ahead and take off the needle shield and the needle guard. There is your sub-Q needle. I'm going to go directly into the skin, squeeze it, go directly into the skin that I just cleaned. Bring my wings down. And then I'm going to go ahead and take my Tegaderm and place that over my wings to secure the needle sets. If your patient moves a lot, Tana does not move. But if your patient does move a lot, remember, you will need to hold that needle in securely. I'm just going to take and remove my Tegaderm, the paper off my Tegaderm edges, make sure my needle is nice and secure. There's my first needle set. My next one, I'm going to go ahead and clean again. You want to make sure that you're at least 2 inches apart from each site. So I'm going to move down on her outer leg again. I want to be 2 inches apart. You can see that she's got good subcutaneous tissue there. I'm going to do my skin prep again for 15 to 30 seconds. I'm going to take my next needle set. Again, remove my paper tab. Remove the outer elastic band. Bring up the wings back to hold on to. Remove my needle shield. And then I will go ahead and insert right into where I prepped. Straight on in, secure. And bring my Tegaderm over and secure over that needle site with my Tegaderm. Remove that paper outer edge. And you're good. All right, we're going to finish with the last 2 needle sets. Again, we're going to do the outer thigh. You do want to watch, some legs are quite vascular. Tana has some pretty vascular legs. So I am avoiding, when I'm putting my needles in, I am avoiding any veins that I see because we don't want this to go IV. I'm going to take off my elastic band. I'm going to bring my wings back to hold, take my needle guard off. And I'm going to go ahead and insert right into that site that I just prepped. I'm going to hold it. I'm going to put the Tegaderm on. And I'm going to just remove the paper edges again, sealing down the edges. And I'm going to grab one more alcohol prep and do the last needle set. And again, 2 inches away from each other. And again, she's got nice subcutaneous tissue out here, but there's a vessel that kind of goes right here, so I'm going to go out just a little bit to avoid that vessel. And I'm going to grab my last needle set, take the paper tab off, the elastic band, bring my wings back, my needle guard off, and I'm going to insert right where I just prepped her skin. And I'm going to place the last Tegaderm dressing on there. Without getting the other tubing underneath it at all. Remove the paper edges. And I now have all 4 needle sets in place. Now it's time to place your plunger into your pump. So the Freedom60 pump. The plunger, the number side goes up and the plunger goes down with the wings of the plunger going in like that. So again, I'm just going to show you once again the plunger, numbers up, wings sideways, horizontal, and they go in, you push in, And then this little round disc sits right here on the pump. Push it forward so it locks it in. And then now you are ready to start the pump and the infusion. So I'm going to go ahead and start the pump. First, I'm going to unclamp her other needle sets that are appropriate. And I'm going to go ahead and turn my pump on. And the plunger will be pushed by this black tab. As you see that come down, you'll see it and you'll hear it. Now it's going to go silent, but it's going to gradually push this plunger. So it's pushing the fluid in through the verserate, into the tubing, into Tana. Notice you have a little bit of an air bubble in there that just kind of creeped in there with the checking, and that's okay. This is sub-Q, so that little bit of an air bubble, that'll disperse once it goes in, and it won't make its way all the way to the very end. So I'm going to leave her at 3 for now. As it starts to infuse, I may bump her up to 4 or 5, depending upon how she tolerates the infusion. During the infusion, again, cold packs for comfort. Warm packs afterwards to help absorb the sub-Q G into the skin. There is going to be a raised bump at each of the sites where it's infusing. That will take 24 to 48 hours to resolve. It should resolve that fluid. The sub-QIG should absorb into the skin, and there should be no redness, swelling, or signs of infection at that site. If there are, you do need to report that to the physician. The other thing with sub-QIG, it can sometimes cause adverse drug reactions, so you do want to always make sure you have Tylenol, ibuprofen, and Benadryl in the home. Some children who have had previous exposure may have had some adverse reaction. Some pediatric patients also have EpiPens in their home during the administration. And that is sub-Q IG administration. Once the infusion has completed and it infuses, we will go ahead and clamp the clamps. We will remove each of the needle sets, put direct pressure on, and then put a Band-Aid at each site.